My name is Jana Evans. I'm the Director of Benefits here in the U.S., and it's my honor to introduce Dr. Priest to you, our Chief Wellness Officer, who will spend the next 30 minutes addressing our topics.
Good morning and welcome. I'm so glad you're here today to participate in our conversation and talk about raising awareness for breast cancer. There is a lot of awareness about breast cancer, but there's still not a lot of knowledge or understanding of breast cancer. And we have spent millions and millions of dollars studying this disease. I think that treatment has come a very long way. Women in general are not dying from breast cancer like they were even 20 years ago. Our treatment is getting better and better. And one thing that we need to know, especially as we leave from this program today, is that early detection of breast cancer is very important to improve survival and for women to live longer with breast cancer or even possibly be cured from breast cancer. Most people know this statistic, but 1 in 8 women in the U.S. will develop breast cancer over the course of her lifetime. I don't want to leave you men out. 1 in 800 men will develop breast cancer in their lifetime. It's a lot less common, obviously, and that's why we don't screen men. Men don't go and get regular mammograms like women should because the incidence of it is so low. So that ends up being about 2,000 cases in the US a year of male breast cancer. And women, we're much, much higher than that. So if we look at all the cases of cancer in the United States in 2018, 30% of those were breast cancer. And these are just for women. All other cancers are much, much smaller in incidence. And mind you, we aren't looking at non-melanoma skin cancers. So we're not looking at squamous cell cancer or basal cell cancer. Those are very, very common, but they tend to not be diseases or cancers that spread or metastasize. So we're only looking at cancers that can shorten our lifespans here. So 30% of the cancers seen last year were breast cancer. There is a misnomer, and I hear this all the time when I recommend a woman to get a mammogram. She will say to me, well, it doesn't run in my family, so I don't think I need a mammogram. In fact, Utah, we have one of the lowest mammogram rates in the United States. We're either the lowest or the second to the lowest. Women here in general aren't getting mammograms. And I think part of it might be, well, it doesn't run in my family, so I don't think I need to worry about this. So one thing to understand is that only about 10% of breast cancers run in families. Only 10% are inherited. And some of you may have heard of the gene that actually causes inherited breast cancer. It's called the BRCA gene, BRCA1 or BRCA2. So the other 90% of women who get breast cancer, it's not from your genetics. It's related to our lifestyle and maybe medications that we've used. Getting older is also a risk factor we can't control. Being a woman is a risk factor we can't control. But there are some things we can control. How we live our lives, what we eat, how much we exercise, and what we weigh are all things that we can do to lower our risk of breast cancer. So Angelina Jolie, most people have heard of her and know what happened to her about 4 years ago. Her mother, aunt, and grandmother all died of breast cancer. And this was about the time when we were starting to test people for the BRCA gene. Sure enough, after her family history, she decided she wanted to be tested. She was positive for the BRCA1 gene. She was told she had an 80% chance of getting breast cancer and a 50% chance of having ovarian cancer, which is also part of inheriting that gene. She decided in 2015, I believe, to have both of her breasts removed to reduce her chance of getting breast cancer. So her risk was 80% of getting it in her lifetime. After she had surgery, her risk went down to 10% because maybe there was a little bit of residual tissue or something still that they couldn't entirely guarantee she wouldn't get it. But then a few years later, she had her ovaries removed so that she wouldn't get ovarian cancer. So let's talk about prevention. This is one of my favorite things to counsel people on. There are 6 easy steps I want you to remember that can help lower your risk of getting cancer by about 50%. This is for breast cancer and also other types of cancers. And probably most of you know what some of these are. So we want to get to and maintain a healthy weight. Being overweight, being obese accounts for about 30% of breast cancers. It's also a very large risk factor for other types of cancers as well. So if you're a man in this room, we still want to be at a good, healthy weight because it's going to lower your risk for prostate cancer and probably colon cancer as well. We also want to get regular exercise. The very minimum amount of exercise that's recommended to be healthy is 30 minutes, 5 days a week. If we have a family history of cancers, if we have other risk factors, we should exercise more than that. So I think if you want to do your best to prevent cancer with exercise, I recommend 4 to 7 hours a week. So there's lots of tips on how to start exercising if you're not a regular exerciser, but I think one of the most effective is to start with a very small goal. If you're not exercising now, then maybe say, I'm going to start exercising 10 minutes a day. And it can be a brisk walk. That is good for us. We want to get our heart rate up. And if you do 10 minutes and say, I'm going to do that 5 days a week or every day, and you slowly start building that up and try to aim for a goal of 4 to 7 hours a week of moderate exercise. My favorite one, eat a mostly vegetarian diet. I am never wrong if I tell people to eat more plants. There are known agents in plants that fight cancer. And the more of these that we're getting into our body on a regular basis, it's going to lower our risk for cancer, all types of cancers, not just breast cancer, all types of cancers. We also want to eat a lot of fiber, whole grains, and even some spices are known to have chemicals and elements in them that help fight cancer as well. Reduce alcohol consumption. I think the latest evidence that's coming out is saying that for cancer prevention, there's probably no amount of alcohol that's safe. But we think that if you already do drink and you limit it to 3 drinks a week, that should be low enough to protect yourself. But I also think, if you have a large cancer risk for other reasons, then maybe you don't want to drink at all for that reason, that less is probably better. And remember, 1 glass of wine, 5 ounces, equals a 12-ounce beer and is the same as a shot of alcohol. All of that is considered one drink. Stop smoking. If you're smoking, that's one of the best ways you can lower your risk of cancers. Not just breast cancer, but obviously lung cancer and mouth cancer and some other things related to smoking. So for the women out there, we want to be really careful about prescription hormones. I'm really talking about women who are taking hormone replacement therapy after they've gone through menopause. We do know that combination hormones will increase your risk of breast cancer slightly. The latest research and looking into this to give this talk, we are thinking that low-dose birth control pills do not increase our risk for breast cancer. So women who are using oral contraception to prevent pregnancy, we think those are okay right now. But I think we always want to look at why we're taking something. And maybe if we're taking something that we're not getting a lot of benefit from, we should probably not be putting that into our bodies. So discuss that with your provider and make sure you're the right candidate to stay on these types of medications. So things to know about detection and getting mammograms. So early detection will reduce your risk of death by 30%. And the reason why we want to find something early is most cancers are treatable. Some are even curable if we catch them early. So I've always been told that a mammogram will see a lesion in your breast 2 years before you or I could feel it on an exam. So that buys us a lot of time. 2 years in cancer history might be the difference of saving your life. So for women that have had a mammogram, you know they're a little bit uncomfortable. They're over very quick. They usually last 20 minutes. They're not excruciating. I don't have people come back and tell me that it was so painful that it made them cry or anything like that, but they are a little bit uncomfortable. Know that going into it. It's not the most pleasant experience, but again, it's quick, it's fast. They do hundreds of mammograms a day in most of the hospitals here, and they are very good and really quick at doing them and trying to make you as comfortable as possible. There's very, very little radiation that comes from a mammogram. That's a lot of fear that people have. You know, am I getting too much radiation? Am I exposing myself to too much of this? And we think that having about 3 x-rays a year is okay. Of course, if you don't need them, we don't want to do them. But so having 1 mammogram a year, if you're not getting a lot of x-rays, other x-rays, should be okay. One other little tip is when you go in for your mammogram, don't wear deodorant. The minerals and some of the metal in deodorant may cause a radiologist to think there's some microcalcifications in the x-rays that can cause a false positive. So just remember that little tip when you go in to get your mammogram. All the hospitals here in the Valley are doing digital mammograms. So those are also called 3D mammograms. Right now, we think those are a little bit better at picking up problems in dense breast tissue, which is what a lot of young women have. So women less than 50 in general tend to have denser, more solid breasts than women as we get older. So if you're under 50, we want to make sure that you're having a digital mammogram.
So over 50, a regular mammogram fine?
They're actually doing 3D in older women too, over the age of 50. In fact, 3D has pretty much become the mainstream way of doing.
Insurance usually covers the 3D?
Yes,
Oh.
Yes, absolutely. If you go to one of the hospitals here in the Valley, they're all doing 3D mammogram.
Okay.
All the hospitals are also doing computer-aided detection. What this does is on the computer, there's a program that will look at the images and highlight any areas that the computer thinks look abnormal. And then the radiologist still has to read those films and decide if it's something that needs to be explored further. And on all the mammograms I get back from the hospitals here, they all say they were read using this computer-aided detection. Most people like to go back to the same facility year after year. They get to know you, they have all your films, and when a radiologist reads your mammogram, they're looking back to all of your prior films and looking for anything that's new or different. If you go to a new facility or you move, they're going to request your prior images. So just be aware of that. And sometimes it'll take a little longer to get your mammogram report back if they've requested old images or prior pictures. If you have a copy of your results, you are welcome to bring them with you to your next mammogram appointment. And I don't see a lot of people carrying around films anymore, but they used to do that. Now everything's on a disc, and most hospitals can just transfer that information for you. So another thing that I think is really important is that a lot of women will get a call back that there was something suspicious on their mammogram. If that happens to you, please know that most of the time it's not cancer. So for every mammogram that's done, 1 in 10 will need additional testing. Of that 1 in 10, only 8 to 10% of those will actually be recommended to have a biopsy. Then of those women getting a biopsy, 80% of them are not cancer. So your odds are really good that if you have an abnormal lesion or an area seen on a mammogram and you get additional views, they are not going to be cancerous. So keep that in mind. Mammogram is still our best tool for screening. They're not perfect, however. They may miss a cancerous spot in about 20% of images, but they're the best we have right now for screening. We can also know our own bodies, and I think women occasionally will find lumps that they are worried about. So knowing your body, knowing if something is different and changing should prompt you to have that evaluated. A lot of times we'll do an exam in the office, and then we always order additional testing to look at those lumps and make sure that things are okay. Sometimes we'll order additional testing like an ultrasound or even a breast MRI if we're worried about a spot and a mammogram is normal. Sometimes we'll look at a breast MRI to get a better picture. So most women should start screening after the age of 40, and most women should have a baseline mammogram at 40. This isn't the case for everyone. Some women who have breast cancer in their family, maybe they have the BRCA gene in their family, they'll often start screening in their 30s. But most women start at 40. There is a little bit of controversy in different societies about the age that women should start having mammograms. So I think talk to your provider, think about what your risk is, and everybody is different. Some women want to start at 40, some want to start a little bit later, and I think that's a decision for you and your doctor to make together. I want to thank breastcancer.org. They have been a wonderful resource for me as I was putting this talk together. I also want to let you know that they're a great resource for any of you that want to know more about breast cancer, that maybe you have a family member or yourself that has been diagnosed. It is very well written. It's a great site for education. They also have a Spanish version. They have it all in Spanish as well. So it's a great resource if you can remember to use them if you have questions come up. Breastcancer.org. Merit has partnered with breastcancer.org, and in the month of October, for any of our Scout devices that are sold worldwide, we're going to make a $1,000 match donation for every device. Again, I just wanted to mention breastcancer.org because they are a great educational website if anyone has more questions after this, or if you just want to look them up. So I'm very proud to work for a company that is leading the charge in breast cancer diagnosis and treatment. And I just wanted to make you aware of some of the products that we have here that maybe some of you even work on or are familiar with. So we have a couple of biopsy devices. The most used device for breast biopsy is our pink Achieve. I wanted to mention that. We also have a great new device. I believe we just acquired this a year ago, the Savvy Scout and the Savvy Brachytherapy. And the Scout is very neat technology. So the old-fashioned way of doing a breast biopsy is we used to put a needle, a wire, a guide wire, into a woman's breast where the breast cancer tumor was. This would often be done by the radiologist, and then the woman would have to wait with that wire in place for several hours, maybe even a day, until the surgeon could operate on them and take out the lump. But now we have new technology where we are actually using a little tiny seed that can be placed at the time of a biopsy that will localize where the tumor is. The surgeon can go in and do a lumpectomy using our equipment, and somebody doesn't need to walk around with that wire anymore. It actually saves more of the breast tissue, and it is a really cool device, and we make those here at Merit. We also do some breast cancer treatment with our Savvy Brachytherapy. And this is localized radiation that we use in a similar technique where the radiation is very localized to the area in the breast that the tumor is at. And now we have just a quick patient video I want to show you.
I love to sit on the edge of a lake. I don't necessarily want to catch fish. I just want to sit there in the nature and the sunshine and enjoy. Maybe my grandkids are running around. When we got to the parking structure at the hospital, I didn't want to get out. I was terrified. Like I say, I'm not afraid of a lot of things, but I am afraid of going into the hospital. And I broke down, and my husband comforted me, and we made the walked into the hospital.
Got a phone call, I believe, that the mammogram turned out that they could see barely something on a mammogram. She goes every year for a mammogram, and years ago. She she had one that they asked her to come back into the hospital so they could do more extensive scans and stuff like that. That came up negative, and I kind of thought this would be the same thing. So we went out to the hospital for him to do scans, and they left me in a waiting room while they were scanning her, and then the doctor called me in, and I went in there, and he said that they were able to see something, and he used ultrasound to point it out to me, and he measured the diameter of it, and it was small. He was saying it was just a little over a centimeter, and I thought, well, good, we caught this really early, and survival rate is really good when you catch cancer early. It doesn't matter what kind of cancer it is. So I felt pretty good about it. I was still shocked when you hear the word cancer. The doctor was positive. I think he's seen enough of these through the ultrasound. He could tell that this just wasn't going to be a benign cancer. This was going to be the real thing. That was shocking for me. I wasn't expecting this.
When I first met Karen, she was like a lot of women who come to see me with this diagnosis of breast cancer, where you really just want to know what the next step is. What else do I have to do? What's going to happen? And so when we talked about all of the options for her, she really felt like a lumpectomy would work well for her, which I agreed with because she had a small tumor and it had already been localized after biopsy with this Savvy Scout device. At the time of surgery, everything went very smoothly. So she just came in for her operation, came to the operating room, everything went very smoothly in the localization of that area in her breast, and it was completely excised really with the first time.
I don't know when they'll determine if I have to do chemo. I don't know if the tumor board made those recommendations. I'll find out from Dr. Reading today. I don't know if the oncologist makes those recommendations. The reason I hope that I don't have to have chemo is because I took my dad to every chemo treatment that he had, and I saw the effects of chemo on his life and his quality of life, and that it may or may not have extended his life. We'll never know. But every time he had a treatment, weeks afterwards were miserable for him. His quality of life was horrible. I hope if I have to have chemo that I can find the strength that he had to go through that. I wake up weeping. I wake up with anxiety. And I just have to tell myself, this is a bad day. We all have bad days, whether we have cancer or whether we have a job that we hate. And you just have to get through it. I knew my family would be behind me all the way, and they are. They are so behind me, and I feel the strength that they have. They have, my cute daughter, she put a sticker on my car that says, that's the breast cancer ribbon, and it says survivor. And I said, but I'm not a survivor yet. And she says, but you're gonna be. Knowing that they believe that helps me a lot. And I feel like I have to be a survivor for them. I want to be here. I want to be here for my kids, my grandkids, my husband. I want to be here to do all the things we've always done and be healthy.
Doesn't seeing a real live person just make it really neat what we do here, that we work on these devices that save people's lives. So I love that part of my job, and I hope you guys can think about that today when you go back to work. But before I let you go back to work, we're going to go outside and take a photo as a group. And we all I love our colors. We look fantastic. They have the big semi-trucks set up out there with the breast cancer logo on them. So if you all could join us and walk out, and we're just going to be right outside the building here. And I appreciate everyone being here. Thank you so much for your interest. If you have questions, you can grab me on the way out, or you can also utilize breastcancer.org for all this information's on their website as well. So thank you so much. Have a great day.